Do you get your flu shot? Have you ever experienced the flu? Working in a primary health care for 5 years now, I have seen patients that had contracted the flu with the flu vaccination and seen patients that have gotten the flu without the flu vaccination. The symptoms are more serious in a body that does not have the antibodies to fight the flu. Is getting the flu shot worth a few seconds of pain from the injection? The CDC says influenza is a potentially serious disease that can lead to hospitalization and sometimes death. Every flu season is different, and influenza infection can affect people differently, but millions of people get the flu every year. Hundreds of thousands of people are hospitalized, and tens of thousands of people die from flu-related causes every year. An annual seasonal flu vaccine is the best way to help prevent against the flu. I have seen firsthand patients come in with the flu without the flu vaccine. I must admit, it is very scary to see someone suffer that can be vaccinated against. Symptoms from non-vaccinated patients commonly suffer from fatigue, fever, sweats, vomiting, chills, cough, body aches, and some have sore throat. They generally present with very pale color to their face and look very ill overall. Patients that have the flu shot can present with common symptoms, just less serious as their body has the antibodies to fight it off. Why do some people get the flu with the flu shot? The CDC, Center for Disease Control, says one reason is that people become ill from other respiratory viruses besides flu, such as rhinovirus, which are associated with the common cold, causes symptoms like the flu, and spread and cause illness during the flu season. The flu vaccine only protects against influenza A and B, not other illnesses. Other examples is that it is possible to become exposed to the influenza virus, which causes the flu shortly before getting the vaccination or during the 2-week period after the vaccination that it takes the body to develop your immune protection. The exposure may result in a person becoming ill with the flu before protection of the vaccination takes full effect. A third reason why some people may experience flu-like symptoms despite getting the vaccination is they may have been exposed to the flu virus that is very different from the viruses the vaccine is designed to protect against. The ability of the flu vaccine to protect a person depends largely on the similarity or match between the viruses selected to make the vaccine that cause illnesses. There are many different flu viruses that spread and causes among people. The final explanation for experiencing flu symptoms after vaccination is the flu vaccine can vary on how well it works with some people that get vaccinated and still may get sick. In conclusion, it is important to get your flu vaccine to keep from spreading the flu to others. The ways to keep the flu from spreading are getting your flu vaccination, cover your cough and sneezes, and hand washing. There are some of the most important ways to keep the spread under control. Vaccination is the single most important thing you can do to help the flu from spreading. Healthy personal hygiene habits and frequent house cleaning also go a long way to help keep the flu away. If someone in your household does get the flu, keep the person at home, disinfect and clean your home well, and limit the contact with the person whenever possible.